Under contract with Stratis Health, MetaStar and the Wisconsin Office of Rural Health invite you to participate in the Quality Improvement Initiative, Rural Community Based Palliative Care. While there is no fee to participate, the success of this initiative for rural communities and individual care providers depends on the mutual commitment and collaborative efforts of both MetaStar, Wisconsin Office of Rural Health, and the participating organizations. The goal of this project is to increase the number of patients who receive palliative care support in rural communities through a multi-site, interdisciplinary team of professionals who are committed to palliative care services. Through this initiative, we aim to establish a collaborative relationship with those of you who are doing the work in the field by providing you with tools, resources, and support to meet your needs, while learning from your experiences in order to better the health outcomes across the region and across the care settings. In order to do this, we're looking to develop 5 communities with participating organizations, with one of those organizations being a leader for each collaborative. MetaStar would then bring together members of the community for Workshop 1, and during this day-long event, the group would complete the community needs assessment and then develop community goals and objectives. The benefits of this participation include opportunities to attend educational and visioning workshops conducted with community stakeholders, assist in developing community action plans to enhance palliative care services in your community, network and learn from other experts in your state and county, participate in activities that promote and spread palliative care best practices, and receive individual follow-up and support as needed. MetaStar and the Wisconsin Office of Rural Health is here to support each community individual needs through in-person or phone meetings, networking opportunities and sharing of practices from other community collaboratives, assistance with completion for each of the community needs assessment, and data related to palliative care and community potential beneficiaries. Additional support includes quality resources and assistance with planning, implementation, and monitoring outcomes, educational opportunities, tools and resources which support best practice, and aligning stakeholders, support, and ongoing communication. At the beginning of this project, we completed an environmental scan to determine the current state of palliative care within Wisconsin. In order to answer some of the questions needed to move forward, a Wisconsin environmental scan was initiated with the scope of identifying key Wisconsin players and stakeholders, statewide standards and activities, payment landscape, data to identify needs, and finally, determine existing rural community-based palliative care. In order to do this, surveys were utilized. The Wisconsin hospitals received a survey to determine currently provided palliative care for inpatients, outpatients, or both, as well as the counties they served. Wisconsin palliative care providers received a survey to determine counties that they served, as well as service availability. (64% of counties were defined as rural within Wisconsin. Western region counties are 66% rural, while northern region counties are 93% rural. Northeastern region counties are 53% rural, southern region counties are 64% rural, and southeastern region counties are 25% rural. These maps indicate in green which locations and counties are considered rural. (21) acute care hospitals are located in rural counties. The range was 0 to 2, with a median of 0 and an average of 0.5. 43 critical access hospitals are located in rural counties. The range was 0 to 3 with a median of 1 and an average of 0.9. 20% of hospitals within rural counties have high readmission rates. And 158 long-term care facilities are located in rural counties. The range was between 0 and 12 with a median of 3 and an average of 3.4. 81 hospice organizations are in Wisconsin. The range was from 1 to 24 with a median of 6 and an average of 7 in rural counties. 33 palliative care organizations are also located in Wisconsin. The range was from 0 to 10 with a median of 3 and an average of 10 in rural counties. The only county without a known palliative care provider is Pippin. We have strong stakeholders here in Wisconsin with Palliative Care Network of Wisconsin, also known as PC Now, the Wisconsin Medical College, Respecting Choices, as well as WEA Trust. Currently, we are trying to align the interests within rural counties in order to determine if there's interest for organizations to either be participants or leads within this project. For participants, this includes remaining active through September 2020, agree to publicly disclose participation within the project, identification of a day-to-day leader, as well as work on the initial and end gap analysis with the rest of the team, and collaborate with other providers across various regions. Participants also agree to share results, best practices, and lessons learned between meetings. Also, collect and submit agreed upon data. And finally, participate in 2 workshops. The initial, known as Workshop 1, and then our second year workshop for Workshop 2, where we reevaluate our goals and objectives. They would also participate twice a year in conference calls, as well as bi-monthly calls. Every coalition needs one organization to be the lead. The lead organization would assist with hosting physical locations for workshops. They would commit resources and staff to the collaborative by identifying a community leader as well as a provider champion, and would work directly with MetaStar to meet the goals and objectives of the collaborative. We hope that you take back this opportunity to have a discussion within your organization and come to an agreement your organization could take with this collaborative. If you decide you'd like to take a participant role, we will do our best to align you with a leader, but we cannot guarantee this in every situation. I do ask that you send me an email at drichard@metastar.com to let me know that this is a possibility for your organization. If your organization decides to lead, the next step would include completing a participation agreement form, which is available online, as well as contacting myself to determine a date and time that we could start planning Workshop 1. Regardless of what your organization decides, if you have additional questions, please do not hesitate to contact me, and I'd be glad to assist. We want to thank you for your time and your commitment to quality health care across all regions of Wisconsin. Thank you.